2 to 3 years ago, our board of directors made a transformational shift from focusing not just on healthcare services to our community, but also the health and well-being. Prescription for Your Health is going to be the program that accomplishes those goals. Prescription for Your Health is a personalized health plan that's overseen by your physician. It's based on 3 pillars of service. The first is a medical plan of care. That's where the patient or the participant works with their primary care provider to develop whatever they need to do that year, whatever it's lab tests or x-rays or any other kind of things that they need to work on for their overall medical health. That's the first step. The second step is a nutrition and education component to that. And in the nutrition and education component, we do an assessment to see what level of experience people have had with either nutrition or how best they feel like they're going to learn. And we try to provide those services for them. So we'll provide like a nutrition class for those individuals to work with to improve their overall knowledge of nutrition. If they're diabetic, we may provide a diabetes education class. Or if they're a tobacco user, provide a tobacco cessation class for those individuals. And then the third step is a medical fitness program. And we'll do an assessment of those individuals, of their overall fitness level through some testing. And then we set up a fitness program for them to be able to work through to kind of improve their overall health and their overall wellness. And all this is offered free of charge to the individuals or to our participants. We try to tie it all together with a health coach. And our health coach is kind of the integral part and kind of maybe the unique part of this program to be able to help individuals work through and set up realizable goals and then be able to work towards those goals. And when they find a hurdle or kind of a little hiccup in the road, be able to try to work through some of those steps for those individuals to continue on that path to overall wellness.
The program started because I personally started writing prescriptions to the fitness center for my patients about 5 years ago. And our CEO, Doug Bentz, sort of took that idea and ran with it and made it a little more comprehensive. This program was developed because we know for a fact that you can change disease processes with exercise, diet, weight loss. So this is a really important tool to have in our toolbox. I think all of the providers here have patients that use the program and seeing some real benefit.
As a health and wellness coach, we offer support alongside participants, sort of figuring out what their strengths and needs are. It's kind of like putting puzzle pieces together. Wellness can be overwhelming to try to figure out, so sometimes we can see if there are pieces missing and offer support in that way, or just kind of look at overall maintenance and the big picture of health. Having a background in behavioral health, I have sort of adopted this philosophy that we have to meet people where they are and the value of meeting people where they are. So this program really does that. It's designed to meet people where they are. And it's really a great opportunity to be able to be alongside participants in the program on their wellness journey and be able to see that evolve. Getting started with Prescription for Your Health is designed to be simple and easy. There are 2 main ways that we do that. It can be either initiated by the individual or initiated by a doctor. So if it's initiated by an individual, they're the ones that may make contact. They may have heard about our program somehow and they're interested in it, so they can contact our office and express their interest. At that point, we'll give them some information about the program and then contact their medical provider and request their review to see if they're a good candidate for the program.
So at the Center for Wellness at Roane General Hospital, when we get a new patient that walks in and that we identify that needs to go through our Prescription for Your Health program, we'll start them on their medical fitness assessment. We'll get them their height, weight, blood pressure, and then we'll perform a couple different physical tests on them. So those will be a 6-minute walk test, a 5-time sit to stand, and then a grip strength test. And so from there, we can use those tests to kind of determine whether we need to work on their balance, strength, or endurance. So the next step after that initial assessment is we'll have a short kind of consultation, and I'll give them different recommendations on what types of exercise to do, how frequent to do them, how many times a week, how many sets and reps of each exercise we're looking for, and kind of how many minutes of kind of activity we're looking for them to get in a week. We also have different different disease states that we kind of work with, whether it be diabetes, heart disease, people that have strokes. So all of those people have different recommendations that we use to kind of get them moving in the right direction. So the way we follow up with our patients is we'll perform an additional assessment every 3 months. So every quarter they'll do another assessment. And with the quarterly assessments, it'll just be the in-body scanner that we do. So that in-body scanner will tell us their weight, their muscle mass, their body fat percentage, how much muscles in each segment versus their legs and arms, how much body fat they have. And from those quarterly assessments, we can see the trends, whether if they're trending in the right direction, we can kind of keep doing what we're doing. But if we see that they're trending in the wrong direction, we can kind of take a step back, kind of change our plan.
I help my patients by helping them navigate through the big, vast world of nutrition. Because nutrition is not just eating healthy all the time. It's about family gatherings. It's about birthday parties. It's about celebrations. So how do we navigate those things and make those things come together? You try to eat healthy as much as you possibly can. But some days you're going to eat the cake, right? Some days you're going to have the extra slice of pizza. That doesn't mean that you fall off the wagon and you don't ever get back on that wagon again. It means for that brief moment, you're in that time frame. Tomorrow's another day? No, the next second's another time. So that's when you try to pick up and go on. So the Review Expirometer is a new piece of equipment we have in our department. And what it does is it takes the oxygen that you breathe in and the output of carbon dioxide. And by doing that, it gives us your resting metabolic rate. That will give us the basic caloric need the patient has to have. And doing that, they can either help maintain their weight that they have currently, or if they want to lose weight, it gives us a baseline of letting us know how much of a deficit they need to make. At the end of the day, the best part about my job is making a difference. I love what I do. Seeing someone have an A1C of 14.2 and in 3 months getting it down to 5.5. They always come back to me and say, thank you for doing that. And I always say, no, thank you for doing it. Because they take the information that I give them and they're able to use that in a way that changes their life. That's what I love about my job. It's amazing. I could tell you 100 stories about people's lives that have been changed because of this program and how wonderful it is.
Well, I think in order to talk about the positive health outcomes that we've seen for the patients that are participating in Prescription for Your Health, we really have to talk about sort of the community and the patients that we serve. Our community ranks last as far as health factors and health outcomes within the state, in one of the unhealthiest states in the United States. So from our perspective within the hospital, we tried to really focus on a paradigm shift over the last few years. We still treat illness, we treat chronic disease, but what we want to do is migrate toward sort of a paradigm shift to focus upon health and wellness, or wellness within chronic disease states. So for the over 500 to 600 participants that are now enrolled with Prescription for Your Health, we're starting to be able to see changes in health factors and health outcomes for specific patients and groups of patients or cohorts of patients that may actually have chronic disease like diabetes. Sort of the story of our data and the data that we're using for our participants in Prescription for Your Health, it really starts with the patient. So when the patient is enrolled, we do a baseline sort of analysis of specific biometrics on the patient: height, weight, lab values, quality of life scores. And now with our newer technologies, we can assess visceral fat, skeletal muscle mass, and we can also look at sort of their basal metabolic rate. So we can tell the story of the individual patient using their data and as they progress throughout the program. So we assess them at the beginning and we do quarterly assessments throughout the program. And what we can do with that data is we can use that and provide it to their referring provider and to the patient to tell the story of how they are changing their lives. We all know that it takes maybe 7 to 10 days to create a habit. But what these patients and these providers can see, they can see their data and how it's changing and how their lab values are improving and maybe how their quality of life is changing based upon participation. And so it reinforces the importance of their participation. Our physicians can utilize the data to tell the patient the story of how they're changing cardiovascular disease, how they've changed their hemoglobin A1C, how they've improved their diabetes, just by giving them an individual patient-centered report card that kind of uses all of our data, the patient's data, puts it together, and is presentable to the provider and to the patient. So that's kind of phase 1 of data for us. Phase 2 of data for us, we're currently partnering with the WVU School of Public Health to analyze the individualized data and to trend the individual patient's data, but also to trend cohorts of data. So we've recently looked at a cohort of diabetic patients that participate in Prescription for Your Health. We've looked at their lab values and their biometrics that we analyze. We've trended it. But then within the cohort of 150 participants, what we can see, which is scientifically validated through the West Virginia School of Public Health, we can actually see that we've made positive impacts in a cohort, not just an individual. And we can tell those stories of the individual and the groups of individuals and really ultimately tell that story in a way that the outcomes eventually will impact a population, which is our county and our state, which is very, very ill. We can use that data also to talk to our payers about how we're trying to keep our patients healthy or what changes this program has from the perspective of the payers as well. The future of the program, the future of Prescription for Your Health, for us is the future of our community. It's the health and wellness of individuals that are participating currently, but it's the health and wellness of their families and their children that they may be passing positive health behaviors on to, and it's impacting a population of patients over time, and ultimately we hope that it can improve the health of our communities. One patient, one family in our community over time.